down to KZN, talk about healthcare, or it's going to be a problem for healthcare. People are struggling to access it. Over 80 healthcare facilities have been damaged by the flooding, and you want some numbers. It's going to cost 184 million rand to repair them. So where do we begin to assist? Well, let's first of all discuss the impact of this with Lerato Mthunzi from the Young Nurses Indaba Trade Union. Always good to hear from Lerato because, Lerato, you have your ear to the ground. What are your members telling you? How bad is this, A, for your members, for the staff, and also, of course, for the patients? How bad is it? Good morning. Lerato, I suspect you might be on mute. Hit the unmute button for me.
Thank you so much, Gareth. I think first, let's send our deepest, sincerest condolences to the families of those who lost their lives and those who continue to search for their loved ones. The situation, Gareth, it's extremely dire on the ground. We are getting a lot of reports from our members who are saying it's not only about the infrastructure that is dilapidated, where we've lost beds that could be assisting in the disaster, but also that we are struggling just to move from home to come to work and just to keep patients warm and keep patients fed. So to be very honest, I think we are grappling not only with medical care, we are also grappling with maintaining the day-to-day living bare basic necessities in our hospitals.
Lerato, I'm speaking to the Health Minister, 7:30 this morning. I'm hoping you're going to tune in for when I do speak to him. What would you want the Health Minister to do? I mean, it is a very difficult situation he finds himself in, still assessing the damage and the amount of money we're talking about. We're throwing around hundreds of millions of rands in this country at the moment, like Smarties. But what would you like the Health Minister to do if you told him, Minister, I need you to prioritise one thing in KZN today? What is that?
The biggest need on the ground is manpower. We've seen the austerity measures that led to job cuts. We've seen the budget on compensation of workers being cut and slashed into half, even just in the middle of COVID. We need more nurses, we need more doctors, we need support staff on those hospitals. The minister must really prioritize to having more hands on deck, and I think that can surpass everything. Yes, the infrastructure is long-term. We need material resources. We need to keep our people alive. But another last thing that I think is quite important for us, we know with outbreaks such as this one, we are going to see a lot of disease breakouts, your typhoid, diarrhea, but also nosocomial infections in our hospitals. So we are really asking for erection of temporary structures so that people can continue getting healthcare in KwaZulu-Natal.
Are there particular areas that are worrying you? I mean, obviously, we're all keeping a very close eye and as many of the areas as we can, but I'm sure you'll agree with me, Lerato, that areas like eThekwini and Durban, they are more built up. They're more urban areas. Being able to get to patients is a bit easier now. I would imagine it's the rural areas that you're talking about. Ugu, I know, is a big issue at the moment.
Absolutely, Gareth. And you'll also remember that the burning issue in KZN is the fact that these healthcare workers that we assign in this rural of the rural list are still some not getting a rural allowance. So a lot of them, you find them extremely unhappy or refusing to actually be allocated in these areas that really need aid. So, another appeal, obviously, to the minister and the president is that we prioritize giving nurses, all categories, and all healthcare workers rural allowance so that there can be that eagerness to be able to be there, even post this flooding disaster.
Tell me, I'm speaking to the Health Minister, as I mentioned, just after 7:30 this morning. Do you get the sense that this Health Minister is taking your interests more to heart than the previous Health Minister, A? And B, are you confident that this Health Ministry will look after the money better than some are suggesting the previous Health Minister did?
I think we have to be optimistic. I think we always say
Lerato, I'm still with you. Continue. If you're still with me, Lerato, go ahead.
No, I'm saying we do hope that the minister will actually deliver on all his promises. The reality of the matter is that he has been a deputy minister. He knows he's been deputy minister on the two previous ministers. So we are not hoping him to reinvent the wheel. We want him to be able to sweep cleaner than the previous two ministers.
And just today, what are you telling your members, those who want to go to work but are not able to actually perform their duties? It's not just about the money in the end. You say this often. Lerato, last question to you. They want to save lives. How helpless do they feel right now?
We've made a call to all healthcare workers, whether there are times where they're off and those who might be on leave, that we need hands. And I think it's a disaster like this that needs us to put total differences aside and go and get our hands dirty. So yes, we've called on those nurses that are even unemployed in KwaZulu-Natal and neighboring provinces to really go in there and assist where they can. I know most of our leaders are out there and they are actually assisting where it matters most.
Well, I appreciate your time, as always. All the best to you and your members. I know trying to do the best that they can. It's Lerato Mthunzi, Young Nurses Indaba Trade Union, also just telling me what she'd like to hear from the Health Minister.